So when we talk about health, we generally look to doctors for answers, right? Seems like common sense. But we're learning about some interesting research from a UNT historian. It is part of tonight's discussion with our media partners over at Texas Monthly. We've got Will Bostwick with us tonight. Will, thank you for being with us. I know you kind of zeroed in on this new book by that UNT historian. So the first thing I want to ask you, when we hear about health concerns in African Americans, it's not uncommon to hear about the big ones like diabetes or high blood pressure. Constance Hilliard is actually the name of that UNT historian. And she's got a theory about these kinds of health concerns, and she links her theory to past studies in parts of West Africa. So can you talk us through that part of it?
Yeah. So it's pretty interesting, and you're right. Yeah, we go to doctors for medical advice, not usually historians, but Constance Hilliard is a historian. She specializes in African history, and particularly the history of a specific region within interior West Africa. So her early career, she was like poring over these ancient manuscripts, translating material from Timbuktu. And one of the fundamental features she found in these societies was that there was this trade, gold for salt. So one of the things that dawned on her somewhat recently was that, well, if people are willing to trade salt for gold, the salt must be really scarce. It must be really valuable to them. So that sent her on this path, digging and digging and digging. And she ultimately discovered that the communities who lived in these sort of interior West African societies thousands of years ago got by on just a tiny fraction of the salt that we do today in sort of a contemporary American diet. And through that, she began to realize, well, that may actually be tied to some of these health disparities we're seeing in the United States. And so part of Hilliard's argument is that because the vast majority of people who were enslaved came from the same part of interior West Africa, they carry with them the genes of their ancestors and likewise need far less salt. So she's done research to show that this abundance of sodium in the diets of many Black Americans who are sort of the descendants of these people from the same region, that may be responsible for high blood pressure and then subsequently myriad other poor health outcomes.
And honestly, when you look at the diaspora and how widespread it is, the customs that are carried through region to region, and like you said, from ancestry down, it really is interesting to see a tie from a historian. Again, a fresh perspective on something that we've talked a lot about. So Constance Hilliard, this is obviously not the elephant in the room, but we're going to address it anyway. Racism, the color of Black American skin. How does she acknowledge that part of that into the equation here?
Right. And so Hilliard, of course, acknowledges that racism is not only an ongoing and pervasive social issue, but that it has an impact on health disparities. Her argument is sort of separate from that. She's saying there may actually be genetic factors at play. And it's possible those genetic factors, when paired with various forms of systemic racism, make for even worse healthcare outcomes.
I think that's a very important part of the conversation because the history of medical and, I guess, health issues in the Black community have been prevalent in systemic situations where they may not feel like they have a voice or can't fight back against some of that. Hilliard here, she's not a doctor, as we acknowledged and established, but how are doctors or the medical community kind of receiving her theory and her perspective as a historian, tying it to a medical issue?
Yeah, I mean, it remains to be seen to some extent. The book just came out, but I spoke to both a genetics researcher at Baylor College of Medicine and a physician and emeritus professor at Stanford School of Medicine, and they both found Hilliard's work convincing. The physician, though, did point out that before this can inform widespread healthcare guidelines, we need to see clinical trials. We need to sort of verify this in the way that we verify, say, a pharmaceutical recommendation.
Exactly. At this point, it's just a hypothesis, if you will, a thesis.
Right.
So, question on that front. Are we expecting more research to be done about this, or maybe any additional information that kind of supplements the book at all?
Well, I mean, I would expect that. Again, it just came out, so hard to know for sure. But one thing I do know is that Dr. Hilliard's going to be, she's planning to go on a speaking tour supporting the book, and she's going to tour specifically medical schools. And it's just those places that you know, the people employed there are the folks who would do this research and kind of try to verify some of her historical research. So yeah, it could be a really cool kind of transdisciplinary partnership. And I think there could be some exciting work to come out of it.
I think so too. The intersectionality of history and medical, you know, the medical field, they can be married, and there could be some insightful conversations that come out of that. So, Will, we thank you for taking us inside that research tonight. If you want to read more about Will's article, you can do that on TexasMonthly.com. It is there for you. There's also some information about Constance Hilliard's new book if you want to check that out too.